Another illness, tuberculosis, or sometimes people just simply say TB, the same thing. Yeah, the same thing. So tuberculosis is bacterial infection. It's special kind of bacteria they call tuberculosis bacteria. It mainly infection for the lung. We say mainly infection means they still can infect other part of the body, but it's commonly infecting patients' lungs. So that's bacterial infected of the lung. It is chronic problem. It's chronic infected of the lung. It's not acute one. So patient can have these illness or maybe the symptoms months later or maybe years later. Then later on find this illness. The mainly symptoms if a infected lung is the cough. Mostly this cough is kind of dry cough and possible have blood inside. A little bit blood inside. And certainly sometimes cough with lot of phlegm also. So that's basically this illness. This illness is very popular like 50 years ago or maybe 40 years ago, pretty popular. So before 50, 60 years ago, it's very severe kind of illness. We don't have effective kind of treatment for this illness. So a lot of people died with this illness. When people talking about tuberculosis, like 50, 60, or even early, that time, just like people today talking about some people got cancer. But after 1950 or 1960, we have lot of medications to anti this kind of bacteria. So that's truly curable illness right now. And not that popular right now. But still, occasionally, we still can hear about this illness. Like a few years ago, I heard about some school in Toronto. They have a couple students got tuberculosis. So tuberculosis is a transmission kind of illness by airport, yeah, droplet, cough, sneezing, pretty similar like we talking about COVID today. But truly tuberculosis, we can cure it. So tuberculosis is a bacterial infection for the lung. So that's we say, what is the tuberculosis? So that's a chronic process and recurrently happens infections mainly by special kind of bacteria, tuberculosis bacteria, mainly affecting part is lung. So that's tuberculosis. We're talking about chronic. So that means the symptoms It's pretty like slow development, like within few months, and maybe after few years, and then people truly can diagnose it for this illness. But they may got infected few years before. So that's still like we talking about before. It's kind of balance things, passengers and with the body junkie. So sometimes passenger eating, but during that time, your body junkie is strong. You are not getting sick or illness. But when sometimes your junkie let be weaker, like people overworking, tired, then body junkie is weaker. Or maybe didn't got enough rest, didn't got good sleep, and didn't got enough nutrition to eat it. Then their body junkie weaker. So then they will got illness. Similar like we just talking about other illness before, singles, yeah, the same thing. So that's a pretty slow development kind of illness. And the symptoms. In the early stage, maybe no symptoms. Occasionally, people feel tired, and maybe occasionally got a couple times of cough. People just thinking about they may got common cold or whatever. So that's basically pretty early stage. People just feel tired. Oh, I'm so tired these days. But they don't know like what's the reason cause the tired. No special reason. And gradually, yeah, gradually happens. So people may not pay attention from pretty early stage. And later on, gradually, pretty slow development, then people may become. So some people looking for the treatment because they are cough. And their cough, they may also have a small amount, some phlegm coming out. Yeah. Maybe white color or maybe yellow or even green color kind of mucus coming out. And that's pretty commonly happens in the morning. Yeah. People got a couple times cough in the morning, then whole day fine. Yeah, whole day fine. So that's why people didn't know they are sick. But later on, like gradually, the cough more severe, the phlegm is more and more. So more big amount of phlegm coming out. And occasionally even some blood inside, especially in the later stage. In the later stage of TB, always have blood inside, but from beginning, occasionally they may have some blood inside. So that's the clinical symptoms if the infection is for the lung. Then we talking about Western medicine diagnosis for this illness. So Western diagnosis for this illness, uh, from the beginning, we can do some skin tests. So skin tests basically the injection a small amount detoxin kind of tuberculosis go to your skin. And then we see the reaction for it. So if people have vaccine before, they may still reactions for locally little bit red color in there. But if patient truly got tuberculosis, the illness, their reactions will be pretty strong, pretty bigger, pretty bigger and pretty strong. So that's skin test. Skin test is very easily to use. So that's and popular to use. But truly, we couldn't only including skin test make diagnosis, which is for the first step, because some patients, if they are pretty severe kind of sick or ill, they may even don't have any kind of reactions to skin test because their immunity functions like not truly working properly and their antibodies is not truly reactions like our T cells not truly reactions for the skin test. So that means skin test negative is not means the patient without tuberculosis. Skin test positive people will have tuberculosis, especially some people pretty severe kind of sick or illness for a long term, like HIV kind of patients. They truly don't reactions for skin test, but that kind of patient, if they got tuberculosis, they are not reactions for skin test. It's not that means they are not got tuberculosis infected. So that means we need other method or other way to make diagnosis. So some other way diagnosis, we take some samples coming from people cough and phlegm. Then we culture it. Yeah, then we culture it. When we culture it, we like the bacteria grows in the like some special container there. We put the like spreading in there and like the tuberculosis especially grows in there. Then we take and the microscope. Then we can see special kind of like the bacteria in there. Then we make diagnosis. So that's truly we see that special kind of bacteria in there. That's clear diagnosis. But culture way still have some others like effected or result. Like a culture tuberculosis kind of bacteria is pretty slow compared culture with other bacteria. So it may take 2 to 3 weeks. Then we can get clear diagnosis. So how about the patient? We couldn't waiting 2 to 3 weeks without treating the patient. So truly culture is pretty good way to make diagnosis for this illness, but it kind of slow. And the same thing, we take some samples from our trachea or bronchi tree, still take some phlegm or maybe take some tissue especially in there and put under the microscope, but still not effective. So we're talking about a bronchi tree. We put a special camera through the nose or mouth to the trachea, to the bronchi tree. We try to take some sample from there. But depending where the patient have sick or illness area, so your special kind of camera, if exactly go to that area, you can take a sample. They contain tuberculosis kind of bacteria there. But sometimes the sick area pretty smaller and your camera is not that easily go to there. So still not that effective. So more popular way we make diagnosis. Patient have clinical symptoms, and then we do chest X-ray. Certainly, right now we also can use CT scan and MIR tracking. So X-ray, CT scan, MIR because emerging kind of tracking, like we truly see the shape of the lung. And we see the shape like some damage in there or infection in there. So that's truly combination with the symptoms. Then we know like we have special kind of shape, lung damage in there. Then we got the basic idea. This patient may have tuberculosis infection. Especially sometimes we ask patients if they have family history. So there are pretty much chance people have tuberculosis infection. Then we still send a sample to bacterial culture. But at the same time, we treat the patients first and then waiting culture result. So that's basically clinically. We need combinations skin test with typically chronic cough or maybe some blood inside. And then take X-ray check or CT scan check and some sample go to culture or even take some sample from special kind of camera and still try to find bacteria inside. So that kind of combinations together, then we make a diagnosis for tuberculosis. Then we're talking about the treatment, the Western medicine treatment. So Western medicine treatment for this illness is pretty long courses. We talk about at least 6 months to 9 months. And for like a pretty light kind of patient, it's not severe kind of patient. So that's basically we need a combination, different kind of medication, not only one. Yeah, not only one. So we if we use only one, like a special medication, antibacterial infections. So some other bacteria may be working, but not truly working for tuberculosis. Tuberculosis kind of bacteria is pretty easily changing. They are pretty easily changing, like a specially resistant for some special kind of medication. So usually with combination use at least two or even three or four different kind of medication. Then treat 6 to 9 months or even over a year. Then we can treat or cure this illness. So it's a pretty slow kind of process. But truly right now it's very effective. If patient follow or plan, follow like we gave the medication to use, they truly can cure it. But just because the treatment plan look like so complicated, use different kind of medication, yeah, 2 to 4 different kind, and treat need 6 to 9 months or even a year. So some patients, or I can say lot of patients, they may not truly finish whole the plan, whole the treatment process. So because like I just cough, and then after I use the medication, 2 months, I totally recover. And the doctor tell me I still need to continue to use the medication. Why? I know the medication usually have side effects. So that many people maybe they stopped after a few months use medication. So that caused the patient recurrently having the illness. So truly, if they totally finish whole plan, they totally can cure it. But if they are not finish the whole plan, then the bacterial infection can happen again. And then more and more drug resistance kind of tuberculosis will be happening. So that's why still even they have pretty effective kind of treatment plan right now. Still some tuberculosis kind of patient, they may got a severe kind of situation or even die because first treatment they didn't finish the whole treatment plan. So that's basically for Western medicine treatment. Then we're talking about the Chinese medicine. Yeah, Chinese medicine category. This illness, yeah, happens hundred of years or even thousand years. So it's a pretty long history about this illness. So in Chinese medicine, we have different names. The pretty common name is 肺痨. 肺 is the lung. 痨 is consume patients, like lung tea, severe kind of deficiency kind of situations. That's a pretty common name. Certainly, we have some other names relationship with the symptoms, like 劳咳. 劳 still consumer patients. 咳 is cough, or maybe patient have fever or 热. So that's including different symptoms we may give different names. But truly, that chronic disorders cause patients severe candle deficiency, candle disorder. So then we see the symptoms part, adding low fever here, adding low fever. Reducing low fever, reducing low fever. So these kind of patients, they will have fever, but low degree kind of fever, like under 38 degree fever, especially fever in the afternoon. Yeah, fever more in the afternoon. It's not high fever. It's not high fever, but always have some low degree kind of fever in there. So that's another symptom. So cause of the illness, we're still talking about the balance, external positive evils, and with internal body 正气, internal body 正气 deficiency, then positive evil invading. Thus, mostly long-term have some other illness, people getting aging, and also maybe people use some special kind of medication, drugs, and also they cause body 正气 kind of disease. Then we go to different patterns of this illness. For TCM, the pretty common pattern of this illness is lung indifferency pattern. So that's pretty common pattern for tuberculosis. The main symptoms of this pattern: dry cough, indifferency, damage body fluid, and cause dryness condition, and dry cough, scanty kind of phlegm, still indifferency, damage body fluid, and the phlegm will be scanty and sticky, difficult coming out. And we say indifferency, the heat damage blood vessels can cause the blood in the phlegm. Other symptoms including chest pain and tight fever. Thus we say mainly happens in the afternoon. And some heat flushing, dry mouth, dry throat. So patient can have special kind of indifferency kind of face. Like especially on the cheekbone area is redness in there. It's not a fast red. It's not fast red. It's kind of a dark red. Yeah. Especially in the afternoon. When people got a low degree kind of fever. It's kind of makeup in there. kind of makeup. And the right tongue, maybe with a little bit thin yellow coating there, maybe no coating there. And the rapid pulse, but thin, because difference, thin or weaker. So this part for TCM or treatment first of all, we nurture in and moisten the lung and clear heat, stop cough. The formula we use 百合固金汤 modified. 百合 is the herb's name. It's good for the lung. 固 is fixed or solid. 金 is the metal. By the 5 elements, lung is metal. So we especially use 百合 inside as a king herb to fix the lung issue. So this formula especially working for lung insufficiency kind of situation. So remember, tuberculosis is a transmitted kind of illness. It can pretty easily passing through from one patient to another patient. So if you treat these kind of patients, the first thing we will suggest it, use Western medicine with TCM together. Well, try not only use TCM. It's pretty chronic problems. It needs long-term kind of treatment. We use TCM with Western medicine treat together, and Western medicine is pretty successful treat these problems already. So we are not only singly use TCM treat these kind of problems. And also the second aspect is protected yourself with the mask and hand washing, hand hygiene. So if you meet this kind of patient, so the first one combination with the medicine with TCM and also protected over yourself. But truly, 百合固金汤 is pretty good formula. Treat lung insufficiency kind of condition. Acupuncture still can use treat this illness. Still remember, pretty good protected for yourself. Yeah, pretty good protected with yourself. Marks of conditions is depending the situation, but truly we can use acupuncture. Patient's patterns, lung insufficiency. We need to tonify the lung and the nursing in. So bladder 13, back through of the lung. And also 高光数 bladder 43. Bladder 43 is a pretty good tonify point. Tonify whole body, tonify qi and blood. So patient have especially chronic deficiency kind of condition. We can think about the tonify bladder 43. And also key 7, kidney yin tonify. Whole body in control by the kidney. So lung insufficiency, we still can go to kidney channel and to tonify there. Especially we talking about that's the meaning, toilet meaning, 无流, double water, regular internal water. So in deficiency kind of patient, they also possible have symptoms like sweating. So that we can go to key 7 to nursing or tonify them. So marks are good for deficiency, but not good for heat condition. So that's clinically we need to see. So if patient in deficiency, more severe deficiency compared with heat, we still can use maxa. But if patient severe kind of heat in there, even deficiency heat, maybe not maxa. And also, if you pick up maxa to tonify for deficiency condition, I prefer use for like kidney one, lower part of body, nursing or tonify there. So basically, we try not to go to upper part of body because heat always rushing up. So points on the leg or maybe spin 6, 3 in nursing or tonify there. So that's clinically I use. Then second pattern, we talk about indeficiency with spare pattern. Generally say indeficiency will have some deficiency heat already. But when we talking about indeficiency with spare pattern here, that means more severe heat rushing up. So truly this pattern is more severe compared with the last pattern. Severe kind of heat in there. And more symptoms relaxation. Still have low degree kind of fever, tidal fever, especially in the afternoon, and night sweating, and constipation insomnia. Like we talking about some disharmonize in the heart there. People, some deficiency heat go to the heart, cause people insomnia and lot of dreams. And the heat rushing up may cause patient easily angry. And the people still cough, still with scanty kind of phlegm or maybe yellow phlegm, leaky, yeah, pretty hard to cough out. And they will have blood inside. Yeah. Like to be more and recurrently happens. And generally the body emaciation and dry. Yeah. Dry skin, dry out, dry mouth, dry out, like a dry anywhere. Yeah. And the constipation, dry stool. And red color, yeah, red lips, and red tongue. This kind of red is more red compared with the generally talking about red. And the pulse certainly still rapid, but thin, yeah, thin, threaded the same. So it's more severe heat rushing up. So this pattern or treatment principle, certainly we still need to tonify in and purging fat. And we still need to transform phlegm and stop cough. especially these kind of conditions, is more blood in the phlegm. We need cooling blood to stop bleeding. So the formula we use here, we use two formula combination together. So the first formula we use 青椒鳖甲汤 That's mainly clear deficiency kind of heat, in deficiency nursing and clear deficiency heat formula. And the combination, 和 just means combination or adding. 玉华丸，青椒鳖甲汤 I believe in our CTCM list. 玉华丸 is the special formula used for tuberculosis condition. It is not in our CTCM list, but truly is long in nursing. So that's the formula with combination used. And the points, points. So acupuncture is still good combination treat for this condition. But the most severe heat condition, we will not use moxibustion. And the points, back of the lung, we still use. Bladder 43, we say that specially nourishing or 25 points, we still use. And kidney 7, we use for last pattern, we still use. But we need more points to clear heat. So 214 is pretty good points to clear external heat and also internal heat. So we can use 214. And lung 6 life points of the lung. So that's nursing in the lung. Nursing in the lung. Then we go to the pattern. Qi and yin both difference. So last two patterns mainly in difference. But truly sometimes patient maybe have both difference. So people cough is weaker kind of cough and don't want to speak, don't want to move, don't like to do exercises, or maybe after moving, all the symptoms is severe. That's qi deficiency symptoms. And still have low degree kind of fever, especially in afternoon, and red flushing, heat flushing. And possible some people maybe can have some spontaneous sweating and some cold sweating, like he couldn't hold body fluid, and then sweating out. And possible night sweating. Night sweating mainly relationship with indifference. Patient possible have both because patient both T and indifference. And fatigue, short breath, that's T deficiency symptom. The tongue, pretty depending, is more indifference or more T deficiency. More T deficiency, tongue will more go to pill side. more in deficiency can more go to right side, and the thin coating or maybe without coating. The pulse is weaker pulse, deficiency pulse, and maybe still rapid because still in deficiency and softness. So for this pattern, we need a tonified qi and a nourishing yin. People still have phlegm there. We still need transform phlegm and stop cough. Patients still cough with blood. We still cooling blood and stop bleeding. So the formula we use 生脉散。生脉散 is especially lung yin and lung qi nursing formula. So that's still in our CTCM list there. And 玉华丸 we talked about already in the last part. That's especially treat tuberculosis kind of conditions. So that's the formula. Then acupuncture. Acupuncture. So still bladder 13, like two of the lung, bladder 43, we say 膏肓术. 膏肓 kind of pretty deeper part of body. That's like a holding our qi and the blood part. So in Chinese, we talk about if some people getting sick in 膏肓, 艾叶, the whatever by doctor couldn't cure it. So that's 膏肓. So backroom of the 膏肓 is pretty nourishing for qi and blood. And we still go to kidney 7 to nourishing kidney in there, regular water. And stomach 36 for qi tonic. Certainly you can add in more points. Yeah, you can add in more points for qi tonic. Like a backroom of the spleen, yeah, bladder 20. And we have ren points, we still can tonify, like ren 6. And these kind of condition, we can think about maxa, but still maxa on the low part because patient qi deficiency still with yin deficiency, still kind of deficiency healing there. Then we're talking about pattern, cold pattern. Deficiency kind of cold, what are we talking about? Yang deficiency. This illness mainly is heat pattern, but truly possible have cold pattern, like yang deficiency. So people still cough, but the phlegm is clear and the form watery and the big amount. So this kind of patient no thirsty and the frequent urination, big amount, or sometimes couldn't control the urine. Looking patient's tongue is pale color. Looking patient's pulse is weaker. So that's generally safe for these patterns. So that's generally say qi yang deficiency cause lung-yang difference the pattern. So treat these kind of conditions. We need warming. Yeah, we need specially warming for the lung. So the formula we use for this one, 甘草干姜汤 modified. 加 plus we another herb. So we just try to remember 甘草干姜汤. So 干姜 mainly warming middle jaw and upper jaw. So we have cold in the lung. So we need warming. And this pattern truly Maxa is good way. Maxa is good way. But we still can use needles combination with Maxa. Back of the lung and the back of the kidney with the whole body yang mainly controlled by the kidney. And generally 25 points, stomach 36, and the spin points. So yang qi always connected each other. We warming yang or 25 yang, we need the 25 qi same time. And with maxa, we can maxa stomach 36, we can maxa spin 3, and we also can maxa some back points. And also 2-4 is pretty good one for yang 25. And certainly some ren points. We still can use maxa. Ren A, ren 4, we still can maxa it. So we have lot of points we can maxa. When we talking about pattern, both yin and yang difference, that's most severe pattern. Yin yang maintenance or body normal functions. If both yin yang difference, that's most severe kind of condition. Cough with blood inside, and spontaneous sweating with night sweating, and lower back pain, soreness, and the body feel cold and chilled, and short breath, and body emaciations, and losing stool. The tongue, like maybe pale color, maybe light be red color. It's depending more severe yin deficiency or severe yang deficiency, and swollen there. The pulse very weak. So that's the condition. Yeah, patient feel pretty weak. Yeah, patient feel pretty weak. So these kind of condition, all treatment principles, certainly with 25 T, 25 blood, and warming internally, including the spleen and the kidney, and we still try to transform from stop cough, stop bleeding. So the formula, we still have two formula here. But I think these two formula is not in our CPMD. And also this kind of severe kind of condition, I don't think we will see in our clinic. But truly that's pretty severe kind of conditions. And acupuncture, generally we say we still use the common ruler of the points, generally lung tonified, and cheap blood tonified and kidney tonified. So that's generally we still can use maxa, Vasquez, but truly this pattern is the most severe kind of pattern compared with other patterns. When we're talking about something, we need remarks. So, like we talked about before, if patient truly diagnosis for tuberculosis, need a combination kind of treatment, Chinese medicine and Western medicine same time. We are not try only use TCM, but TCM is truly help. Yeah, it's truly help. And we talking about tuberculosis. We talking about some common patterns here. We still have other patterns. Yeah, we still some other patterns. So and also tuberculosis. These illness with a mainly evading for the lung, but these bacteria also can evading other part of the body, like they can cause meningitis, evading the cover of the brain, and they can infections can go to urination tract or maybe kidney, cause the kidney tuberculosis. And they can go to like abdominal cavity, cause the abdominal cavity, and the pericardium, or even can cause some big lymph nodules, or maybe invading the bone and the joint. Certainly, the symptoms will be different depending the invading area. Like if they invading the bone and the joints, maybe cause painful, swollen joints there. If invading the kidney, maybe cause the blood in the urine and the lower back most of their pain. So that's totally depending, yeah, totally depending. So that's where it is invading. But truly, most patients mainly evading way or cause problems is the lung, yeah, lung tuberculosis. And then we talking about still something we need to be careful if patient have tuberculosis. So in deficiency kind of pattern, in deficiency kind of pattern, truly deficiency hidden in there. We still try to not eating kind of pungent hard food or dry food. In young deficiency kind of pattern, we should eating warm food and more nourishing food. So still depending what kind of patterns we need, like give different patients like a special kind of food therapy. But generally say tuberculosis mainly is deficiency pattern. Need more nourishing, more tonified, more nutrition kind of food. So I think some people call this illness consumer kind of illness. It's pretty easily happens in poor nutrition kind of patients. And certainly if patient got this illness, they truly need more nutrition kind of food. But be careful the nature of the food and follow the patterns. We give different nature of the food.